Fingerboarding usually is okay to do. Strength training for the most part is very safe to do. And climbing with grip positions that are tolerated well, that don't produce symptoms, also is okay thing to do. But the total volume of stuff needs to drop down.
Hey y'all, welcome back to the Struggle Climbing Show. It is me, Ryan Devlin. I'm your host, and Dr. Tyler Nelson is back as our guest on this show. Tyler's a frequent contributor here in the Struggle Podcast / Utility Closet, and that's because he knows his stuff. And today is no exception. He's talking about all things wrists. So I'm talking about wrist injuries. Yes, we do a deep dive on wrist injuries, which are more and more common now with climbers because of the way, as Tyler explains, volumes are getting bigger and bigger at gyms, and also people are bouldering a lot and taking weird falls. So we're talking about wrist injuries, but we're also talking about making our forearm flexors stronger, and in particular using wrist flexion to get stronger as climbers. So stronger on things like slopers and open hand positions, but also stronger just on crimps and on 3-finger drags and open hand and all of that. So I was really fascinated by this because I don't have a wrist injury, but I do struggle on slopers and kind of that flexion type thing. And so we talk about tools like wrist wrenches and rolling thunders. We talk about training protocols, and then we talk a lot about injury and rehab. And so whether you are experiencing a wrist injury or you just want to get stronger with different grip positions, I think this interview here slaps. And by the way, if you're a Patreon member, I'm going to post the full video of this over on Patreon because Tyler does a lot with his hands. He demonstrates a lot of different hand positions. So I'm going to put the video over there. Oh, and speaking of Tyler, shout out, if you join my email list by going over to thestruggleclimbingshow.com/strong, you will get a free Pro Clinic episode with Dr. Tyler Nelson on the top 10 finger training questions. It's one of the most popular Pro Clinics we've ever done. Normally those are $15, but as a special little thank you for joining my email list, which I am building out right now, you can get an instant download of that. So just pop over to thestruggleclimbingshow.com/strong, enter your email, and then you will get that free download. And I don't send any junk. I just send like good stuff out a couple times a month, and you can quit anytime, yada, yada, yada. All right, let's flex our way into this conversation with Dr. Tyler Nelson. Well, before we jump in, I need to get an update on, before we dive into this, is your skateboarding. What's the update there? You still grinding?
You know, I realized like the hard reality with my hip. Like I have my left hip is pretty messed up. Turns out that like ramp climbing or transition skating is okay because there's not a lot of like quick flexion. But like when I was learning to do ollie, like could get to do an ollie and roll into an ollie, practicing that, my hip was so pissed off.
Yeah.
Just like the quick flexion and like abduction and then landing, that constant motion. Like I was like just noticing that my hip was sore more when I was walking around, like that pinching sensation, like with the labral tears that I have, like that's going to expedite how quickly I need a hip replacement. So I haven't been doing the ollie stuff as much, just as a rational decision. So I haven't been doing a ton lately just because of that.
I applaud you for taking on skate. I just don't feel like anyone after the age of 18 should start to skateboard. So the fact that you threw yourself into it and were legitimately popping ollies is pretty impressive. So good on you, but also good on you for realizing that maybe it wasn't the right fit for you right now, which I think typically most skateboarding, I feel like skateboarding and motorcycling are the two things that typically just end with a significant injury, and yours did not. So I feel like that's a win as well.
Well, it's a weird, this hip thing has been a real bugger for me, but now that I'm at some point I'm going to have to make a decision and get a resurfacing, or I think I need a total hip replacement, but that's a pretty big deal for a 43-year-old.
Yeah, no doubt. We'll try to avoid that for a little bit. Well, we're not talking about hips today. We're talking about wrists. So I don't know anything about wrists. Of course, you did what you always do, which is you put together an incredibly thorough document here. But before we kind of dive into what you've laid out, set the landscape for me. You see a lot of climbers, I'm sure plenty of climbers come to you with injuries. Are you seeing more wrist injuries recently, or why the interest in exploring wrists as a topic?
I definitely see a lot of wrist injuries. I think the research papers on wrist injuries and just the demographic in general of injury incidents, wrists are becoming more injured.
Hmm.
And one of the hypothesized reasons for wrist injuries becoming more prevalent is just hold sizes are getting bigger in gyms. And so
Huh.
the style of climbing is changing a little bit based on the size of volumes. And when people have big indoor seasons, they're spending a lot of time on really large holds. And it's just a novel kind of stress, and that position definitely exposes the wrist to, a little bit more torque and a little bit more passive stress. And so that's one of the reasons wrists are common. But then just like people are psyched and training a lot. And so more people are climbing to them. So there's a mix of a couple different things, new climbers getting on big holds, maybe don't have upper body training experience before. It's just a pretty stressful position for the wrist.
Why would a bigger hold be more injurious or have a higher incident rates of injury than smaller holds?
Just the position. So if you have the wrist like straight and you're like giving someone a high five, that's a neutral position. But if I flex my wrist, in the direction of the forearm, of the flexor side of the forearm, that's called an open pack position. So there's less tightness in the joints and the ligaments and the bones of the wrist than when the wrist is an extension. So when you put your wrist in extension, like you're doing a full crimp, that's what, mechanics would call a closed pack position, where the ligaments get tight, the bones become more adjacent to each other, and there's less range of motion. So
Hmm.
if you try and put your wrist in extension and you go side to side, there's way less range of motion than when it's in a neutral position. And so when you grab on a big hold, you essentially palm the whole hold, and then you're pressing down into it with the wrist and the fingers. And that creates across those 8 bones and the joint a lot of shearing stress on the wrist.
Interesting. So that's like that would be like if you're on a sloper or something like that. That flexion that you're getting where you're pressing your whole hand down, not just your fingers down.
Yep, yep. So you get your whole hand pressing down, and there's also the ability to get, coordinated on a hold and to actually utilize the friction. You want to hang your body below it as best you can. And so if the hold is not oriented, straight horizontal, it's at an angle, we grab onto it, but then we add more rotational stress either towards the pinky side or the thumb side. And in particular, the pinky side is the side that gets the most mechanical load, and the most injury incidence is on the ulnar side of the wrist.
Interesting. All right. Well, then let's talk about, I guess, the injuries that could come from that. And you've laid out a handful here. It looks like by percentage of cases. Is that how I'm understanding the document here?
Yeah, the most common location for wrist pain in a climber is on the pinky side.
Okay.
So if a climber's looking at their palm of their hand, the pinky, and they actually take the pinky and they bend the pinky towards the forearm,
Right.
that motion is called ulnar deviation. And if you do that, it's very obvious that that range of motion is larger than it is the other direction. The other direction, you can't even really go into deviation. And so this position, there's a bigger range of motion there for lots of different reasons. But when you do that, you create a lot of compressive load on this side. And if we add the compressive load with a lot of rotation, there's structures there that get irritated and sore, and some can tear, et cetera. So that's the most common location for pain. And a lot of that has to do with the range of motion.
So on the pinky side, so this is like the pinky kind of pointing down towards the wrist, that would be, what is that there that's getting injured? Is it ligaments in there, or what's what's happening?
Yeah, there's a whole bunch of ligaments. The one that people will Google and find quickly is TFCC, either TFCC sprains, TFCC injuries, et cetera. And the TFCC, so if you're looking at the palm of your wrist and you do this like deviation where your pinky goes towards the forearm and you bring it back to neutral, right where there's that bend, imagine there's like a little triangle right there. And the top part of the triangle goes into the joint. And so there's a little cushioned disc right there that attaches to ligaments in the wrist, and it attaches to a tendon. And that disc is kind of like the meniscus in your knee. It's designed to resist compression. And so like giving it compression is a protective thing, but it can also get strained with rotation, et cetera. But just think about the sheer volume of the amount of times we put our wrist in that position. Just like any other injury, it's an overuse kind of injury, and it can only tolerate so much of that particular stress until it has some sort of symptom that pops up.
And that would be like I tore my meniscus a couple years ago walking down a trail, and I slipped on some leaves, and like my leg went sideways in a weird way, and so that was like a torn meniscus. I don't think there was any other damage in there, like ligaments or anything like that. So there's like essentially a meniscus like kind of part in there, and there could be damage to that, you're saying, but then also there's all these like ligaments that are around it.
Yeah, there's ligaments that attach to it and attaches to a couple different bones of the wrist. It attaches to the ulna, to the triquetrum, and then like a couple different cross parts. But like, I'm assuming you didn't have surgery on your meniscus, right?
I didn't.
You did not. So very common with climbing injuries to the TFCC, the meniscus is made of something called fibrocartilage, which is the type of cartilage that's like the most strong. It's like very durable, very tolerant of compression, but all matter has limitations. So, at some point, at some dosage, having something be sore is totally, an actual reality of loading. And just like with your meniscus, you had an acute injury that happened, and it probably took a couple months to fully go away where you don't think about it. But now you're probably not that worried about it. And the same kind of trajectory and timeline happens with ulnar-sided wrist pain. Even if someone did have like a TFCC injury, most of those respond well to rehabilitation and they don't need surgery. In some cases they do when people have, wrist instability or they have a progressive tear. But there's a lot of TFCC lesions that I've seen with MRIs that get well without surgery. And so it's kind of the same kind of tissue, albeit much smaller.
Okay. And because this one, it looks like you're citing Volker Schoeffel, it looks like did a study on this, and it was saying about 65% of cases are this ulnar-sided injury. Maybe we just explore this in a little bit more depth here before we move on to some of the other ones. What are you seeing are the most common reasons why that injury is happening? And then maybe we can talk about prevention as well as treatment.
Yeah, so Volker's paper is the most recent statistical paper on injury incidents based on their exposure and presentation with their clients. And I think that's very common for people like myself that treat rock climbers kind of exclusively. When people come to me with wrist pain, almost probably 80% of the time, it's on the ulnar side. The other little bit of time, it happens on the back side of the wrist, like when you put your wrist in extension, and we can talk about that. But Volker's paper is actually very helpful in the sense that it shows that most of the cases they saw when clients came in with ulnar-sided wrist pain were not TFCC injuries. That's not the most common climbing injury to the wrist. Although if you search the internet, that's what you're going to find first, because it does happen and it is relatively common, but that's not what they actually were able to diagnose as the most common. What they diagnosed as most common was just synovitis of the joint. So, and a parallel to that climbers will understand is just like you get PIP joint synovitis.
Like in your knuckles.
In your knuckle gets swollen, sore, and pissed off with crimping and pissed off with a lot of volume. The same kinds of, pathology, I think pathologically, physiologically happened at the wrist. But the reason it happens here is just there's just a lot of stress to this part of the wrist because there's so much range of motion. And so I think the diagnostic procedure really is an important, is history taking. So really listening to an athlete's clinical presentation, their training age, their climbing age, what they like to spend their time on, which holds they're intolerant of. All of that is really important in narrowing down the diagnosis, because a TFCC lesion, some of those can create instability of the wrist, but synovitis of the wrist, which is more common, is not an unstable diagnosis.
Interesting. It's painful, but not unstable.
It's painful, but it's painful with certain positions and certain amounts of things. So those lesions might not tolerate a lot of side pulls, aggressive side pulls, or a lot of underclings, because that creates a lot of pressure at the ulnar side of the wrist. But that does not mean that they couldn't do strength training. That does not mean they couldn't do fingerboarding. That does not mean they couldn't do some small volume of climbing. And so it's like getting the diagnosis right is really valuable and necessary for the wrist, because some of the diagnoses you would not respond to strength training types of interventions, where others would absolutely respond well to strength training interventions. So I think that paper quotes, 6 or 7 different diagnoses just at the ulnar side of the wrist.
Interesting.
So not just TFCC or synovitis.
How do you diagnose that then? I come in, my wrist is hurting me when I'm climbing in certain positions. How do you determine what it is?
A lot of it is history taking, like I mentioned, but then there's, what healthcare providers would call special tests that put the wrist in exposed positions and tries to stress those tissues to see if they're provocative. And they're not that sensitive at measuring, at giving the exact diagnosis, but they're pretty helpful. And most, the more you do it, the more familiar you get with it, the more likely you are to kind of narrow down a diagnosis. But you get a basic diagnosis based on those things, and then you try stuff. And so obviously the most important part of managing any sort of injury in a rehab setting for an athlete is the education side, but then being very transparent, like this makes sense. This is what we're going to try. This is statistically likely what's going on. But if our symptoms don't change, we need to modify things and we need to get away from certain things. We need to add other things. So it's kind of like a working hypothesis that needs to change when athletes load based on how they respond.
Is there anything for those who are listening who might be experiencing this and they're not able to get to a PT right away? Is there kind of a dummy's version of how one might assess, like, oh, this pain in my wrist is happening because XYZ?
Yeah. So I would say like most athletes will know what hurts them. So if you're an athlete that, has had a sore wrist and it came on gradually, or even let's say you had a moment where you felt like a click in your wrist and it's been sore for a couple months, you've probably been climbing on it. Most climbers this is one of the things that you can get away with climbing on for quite some time while avoiding certain things. And so if they can't tolerate like underclings, aggressive underclings, they can't tolerate a lot of slope or volume, that's, narrowing down the diagnosis, something on the ulnar side. Maybe if they had a pop in the past, maybe that is some sort of small TFCC lesion. If they didn't have a pop and it just came on, it's likely some form of synovitis. If they have trouble like mantling or doing pressing movements, that might be another diagnosis as like compression of the bone of one of the carpal bones when you put your wrist in that position. So step number one is like stop doing the thing that's pissing it off. And so like fingerboarding is very safe because it's very neutral. It's very not ulnar deviated or radial deviation. There's not a lot of rotation to the wrist as well. So fingerboarding usually is okay to do. Strength training for the most part is very safe to do. And climbing with grip positions that are tolerated well, that don't produce symptoms, also is a okay thing to do. But the total volume of stuff needs to drop down. All the training combined, if you have a week of training, you need to drop all of the volume of those things, maybe 25, 30% for a couple weeks and see what it does to your symptoms. That's a really easy, like kind of general strategy.
Even if you're doing things that don't elicit some sort of pain response, you're doing very neutral, like hangs, like you're saying, or just like crimp edge climbing, that's still putting some sort of stress on it. You're saying cut even that volume, basically cut everything, regardless of whether it hurts or not. Stop the things that hurt and cut the overall volume, even if it doesn't hurt, to just see then what the recovery is like.
Yeah. Yeah, I think so. So think about it this way. If someone was doing like a project and this project has a really stressful move on the wrist and they just did it constantly for maybe 3 sessions in a week, just this hard thing, maybe a hard boulder problem, and the wrist got really sore from that, that probably is more an acute mechanism that particular move is what pissed it off. But if someone's just climbing in a gym and they're doing their normal gym routine and they're maybe doing a little lifting weights, maybe doing some finger training, and the wrist just gets sore randomly, that's more of a total volume thing that, you can't really just exclude one thing and expect your body to recover from it, because stressing it is still okay, but they have to make sure that they're recovering from those sessions or the body kind of doesn't catch up with the recovery that it needs, and the symptoms will stick around.
Got it.
So well, it's kind of different depending on how they originally felt it.
Yeah. Well, I want to talk a little bit about kind of essentially how we could prevent or how one bolsters the wrist, if you will. But before I forget this thing that just popped in my mind, you mentioned these positions like mantling that might elicit some sort of pain response. And just something that I've experienced, and this has been something that's been the case for 20 years or 30 years, as long as I've been like lifting weights starting in high school sports, I've never been able to do dips, like where you do like a deep dip using those little dip bars, or like a plank, a side plank where I'm on my hand rather than my elbow. So like some sort of like that pressure. And I don't think there was ever an acute injury. There's just, my wrists hurt when I go into like that kind of like deep dip position, or that putting a lot of weight on just like one wrist, like on a side plank. And is that related to this, or is that something else entirely, do you think?
So it depends. Like, but you can get away with underclings, no problem. Side
Yeah.
pulls overhead, no problem. So
Yeah.
then in that case, like you would take someone like yourself and say, if you can like grab an undercling. So an undercling is a full crimp with rotation.
Hmm.
So if you take your palm flat to the table and you rotate the palm towards the ceiling, that's called supination. And so essentially, if I do a full crimp and I supinate my wrist, that's a lot of torque on the TFCC. So if you can tolerate those positions very well, that's probably not the likely diagnosis with the wrist. It's probably not like ulnar sided wrist pain. However, if you can't do mantling with the wrist and extension, then that's a different set of diagnoses. But if you've had it since you were in high school and it's really been kind of a mechanical thing, it's probably like just like a joint anatomy, not problem, but asymmetry on that side. And there's probably not a whole lot. You've probably tried to do something about it and it doesn't really change. That's
Yeah.
kind of a function of like the bony morphology, the ligamentous tension, like, the habits that you do, because if it's not tolerated well, it's not likely you're doing a lot of stuff that would expose you to that position. So it's probably not going to change a lot either. But if it's not an acute injury, I would say the reasonable strategy for you, like you've been doing, is stop doing those things, right? You got to find things that you can do that you tolerate well, that don't, expose you to something that's going to be provocative.
Right. Yeah. I just bench press instead of doing dips, and I do planks on my elbow instead of on my wrist, and it's totally fine. But it is interesting how you just mentioned that torque feeling. I was just on the kilter board this morning, and I put a kilter board in my basement, dude. It's the
Oh,
best.
shit. At your house or the cabin?
At my house, I got the
Nice.
home wall, like the full ride. So it's like got these like kind of crimpier, tweakier holds, if you will.
Cool.
And yeah, it's rad. And so I was doing a session this morning with Chris Martin, who you worked with for
Yeah.
some
Oh,
time. Yeah, great dude. He lives right down the street, so he walked over and we got a session in. And anyway, one of the problems that we were trying started on like a really pretty thin full crimp undercling, and I was like, I tried it a few times. I could barely get my butt off the pad. I couldn't make a move on it. But my comment to him was like, God, I feel like I'm torquing my, what are those forearm bones, the radius and the ulna, or like,
yep.
it just felt so torqued out. I was like, it just feels like I'm going to snap my forearm. And so I walked away, and I don't know how it'd probably be really hard to break one's arm at my strength level doing something like that. But it felt pretty heinous. And I guess maybe because it was like, I'm more accustomed to bigger underclings, like where I could really get like a couple pads on it, and then I can get my feet high and really press into it and kind of do like a bicep lock off and go to the next hold. But this one it was only like a half pad or maybe 3/4 of a pad. And I just couldn't press into it without it like I just felt like a lot of stress on those forearm bones, if you will.
Right. Yep. And that's something that you probably don't train that much either. And so
No.
because climbers spend the majority of their time with their their palms away from their face like this, we don't really target the opposite position, which is supination, all that much until you expose yourself to this heinous undercling and you go to your own physiologic range of motion limit in supination, but then you torque on it more because it requires you to get better leverage. And so
Right.
doing that, like you mentioned, a couple times, you're like, this seems too hard, and walking away, no big deal. But if you were really stubborn and that was like a project you wanted to do and you spent a couple hours doing that, like the likelihood that would make your wrist sore on the ulnar side is, relatively high. It's not that position's risky. It's really just maybe you're not used to that kind of stress on the wrist.
Got it. Well, before we move on to other wrist ailments and potential injuries, focusing still on the ulnar side here, the pinky side for the listener, what do you find is helpful for us climbers to do especially if we want to climb a lot on those big volumes and do side pulls and underclings and all of that, in order to help prevent it? Are there preventative measures? Is this something that essentially can be trained up, or is it more, to your point, like overuse injury, regardless of kind of how prepared you are for it?
I mean, there's always a good argument to be made for strength training, just basic strength training practices as a preventive, intervention to reduce injury risk. Why that's the case is really from exposure. Not really that people are weak or climbers aren't strong. It's really just exposing the risk to an intense thing more than the sport relatively frequently should help build tolerance of the sport. So that should be preventive in some way. But ultimately, you have let's say a net, bucket of volume that your risk can tolerate. Anything you put in that bucket matters. And so if I'm doing what quote unquote preventive things at the same time as doing the same amount of volume of climbing, that's not preventive anymore. Now it's
Right.
just adding more water to my bucket and it's going to go over the top, right? Where being more sensible with the amount of volume that we do on the climbing wall, being more sensible with the rest time between boulders, being more sensible with the days climbing during the week, that all is the preventive stuff. But for actually targeting wrist flexion, there's a whole bunch of ways that people can do that now that have become popular, like using the wrist wrench is a pretty, easy to build on your own or to purchase one. That's a pretty easy way to train the flexion position of the wrist. You can also flip that thing around and train the extensor side of the wrist. People can spend time doing, vertical hangs on the campus board on the sloper rungs. You can build tolerance that way, but if someone has a sore wrist, that's probably not the best place to start because it does expose the wrist a little more to those positions where if someone has a sore wrist, basic strength training stuff is very safe. Like doing pull-ups, doing deadlift, bench pressing, all those things are very neutral at the wrist. There's not a lot of rotation or side-to-side motion. And so it's important for people to think about, it depends on the style of climbing that they're doing, where it doesn't sound like you're climbing on slopers much because you have a board at your house or you're climbing at the red.
Right.
And so if you went, like you mentioned, going to Chattanooga to Boulder, you went there for a couple of weeks, your wrist would probably be sore. Right. And so it's not that your wrist is weak all of a sudden or it's got some symmetry problem. You're not used to that regular exposure with the big flat palmed holds that you just need to build a little bit more tolerance. So people can also periodize their preventive measures based on the time of the year, depending on what they're going to be doing in the next couple months too.
This episode is sponsored by our friends over at PhysiVantage. By the way, PhysiVantage has been a sponsor of this podcast since the very first episode, and that's because I sought them out. I've been a fan and a paying customer of PhysiVantage since long before there was a Struggle Climbing show. And why would that be, Ryan? Well, because it works, y'all. Their products are made by climbers for climbers. They are science-backed, and then I have just been testing them on myself, a guy in his mid-40s just trying to get after it and level up day after day and year after year, and the PhysiVantage products have really helped me to feel better on and off the rock. My favorite products that I take every single day are the greens. I have those every morning, and I'm telling you, I'm getting sick way less than I ever used to, and I've got 2 young kids, so that's saying a lot. And then I also take their supercharged collagen before every single workout, whether it's a finger training or a climbing day, and their protein. I have their vegan protein or their whey protein, usually once a day, sometimes twice a day as my little treat. Their chocolate flavor is out of this world. I'll mix it in with plain Greek yogurt for even more protein, or I'll just shake it into some cold water. It's just that good. I love everything they make, and I love how I feel. If you want to push yourself in your training and in your climbing, I really do think PhysiVantage is going to make you feel better. And if you want to get a discount, you can use code STRUGGLE15 at checkout to get 15% off your order. That also helps to support me and the show, which I really appreciate, and all of that information is in your show notes. This episode's brought to you by the Force Board. Are you into training your fingers? Dumb question. You're a climber. You're obviously obsessed with your finger strength. You're probably looking at your fingers right now as I'm saying this. And let me tell you, the Force Board is a huge step up from hangboarding. If you're not familiar with what a force gauge is, it's this little digital device that connects to your phone, and as you pull on a block or a portable hangboard, it tells you exactly the force that you are using so that you don't need to mount a hangboard, you don't need weights or pulleys to get the desired training stimulus, and you can track all of your data seamlessly and program your workouts right there in the app. And training your fingers this way, let me tell you, instead of doing weighted hangs, reduces injury risk and is just a heck of a lot faster, easier, and more more consistent. I've been using one for months now. It is super portable, so I can easily bring it with me to the crag or to the gym for warm-ups. And then I'm also using it to train up my endurance right now, doing some 7-3 repeaters at 60% of my max, which is super easy to program because the app gives me that target line to hit on each and every pull. And as soon as I can't hit that target, I know my session's done. Boom. That's it. I don't get injured. I don't get overly fatigued. Hit that link in your show notes or swing on over to thestruggleclimbingshow.com/forceboard to learn more about it and score yourself $10 off your purchase by using code STRUGGLE at checkout. When we talk about making the wrist stronger, are there muscles in the wrist, or are we talking about the forearm essentially? Like when I'm putting flexion on, if you get, like, you see Emil on like the Beastmaker or whatever, like I can't even lean on those holds, but essentially like you're pressing in as hard as you can, and that's just your forearm flexor bundle. It's the same as what your fingers are using.
Yeah, more or less, but the wrist flexors actually stop at the carpal bones, and the finger flexors obviously go all the way to the fingers.
Right.
And so a sloper is a good example, like the Beastmaker slopers, being able to palm into it. The flexion at the wrist there is definitely primarily wrist flexion strength. And you have to like drag on the skin, obviously, to hold the position. So you need that friction. But that's definitely a forearm muscle activity. And so when we talk about making the wrist stronger, obviously recruiting more muscle fibers in the forearm muscles matters. But also we need to make the wrist ligaments and the tendons a little bit stiffer. And that's one of the good things about strength training is it's the most accepted way that you can increase the material stiffness of connective tissue. Therefore, you can like transfer force a little bit more efficiently when you pick up your feet. Because like grabbing onto the sloper, it's always like a sag, 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 sag. Okay, pick up my feet, and then hold it for a little bit, and then you let go, right? So that efficiency really is a stiffness thing. So we are training the muscles to help stabilize the wrist joint. But the other caveat there is like when people get sore wrists, it's usually from fatigue. So if I'm doing those things that are very stressful to the joint, when my muscles are tired, I lose that protective benefit that I get when I'm fresh. And so that's where training volume and session volume really matters, because people will have like a session. They're like, I don't feel any pain. Then they'll go really hard. Then the next day they'll be like, oh my God, my wrist is really sore. And so there's like kind of a disconnect a lot of times with in the moment pain and like long-term management.
So with regard to the specific training of the area around the wrist, and so there's lots of muscles on the top of the forearm and the bottom of the forearm, but you mentioned a wrist wrench there. You mentioned hanging from like those kind of an Talon grip or a sloper grip kind of ball on a campus board, or if you've got one hanging just in the, in the basement. Would you suggest doing that prior to a climbing session as part of a warm up? And are we taking something else out so that we don't then risk some overuse?
So it depends on the case, of course, but like I think that makes sense to do some basic strength training before climbing if someone has a sore wrist. The argument there is really just to wake up a lot of muscle. I just want to wake up a lot of muscles. I want to do it in a way that's easy to quantify, that's easy to perform, that feels safe, that doesn't have so much variety like climbing. So the athlete knows that they're warmed up to do the climbing. I like that idea. The other one that I do quite often is like doing resisted supination. So like, and if people have like this idea that there's the same forces in both directions, that's kind of a confusing thing for people. I talk to people that will do pronation, which is essentially turning your palm towards the table position, and supination is turning your palm upward. And so supination will always be stronger than pronation because the bicep muscle is the primary supinator, and the bicep's quite large. But when I do pronation, it's the wrist flexors and some small muscle in the forearm. And so I like the idea of doing supination too. So people doing bicep curls, or you could use a cable machine and a loading pin and literally turn up against resistance. But for people with like ulnar-sided wrist pain and it's an acute setting, I wouldn't start with those really intentional positional exercises, because they're ones that are just like, they're more exposing to rotation. They're not as protected from the muscle standpoint. There's a long lever arm. And so it kind of depends on the individual case as to what they're doing before. But I would say, yes, in general, strength training before like makes good sense for someone with wrist pain.
How much crossover is there, since there's so many of the same muscles that we're talking about here, to crimping, if we were trying to crimp or full crimp or drag or whatever? If one wants to incorporate some of that training, a wrist wrench, for example, would that also benefit a closed grip? And if so, then again, would that allow us to sub in wrist wrench work in place of other kind of dedicated finger training work?
Yeah, I think that's a good question. I think the wrist wrench or the rolling thunder, which is another one that I use. I use the rolling thunder for my open position finger training, and it definitely will get the wrist and the finger flexors because it wants to spin, so it requires a little bit more of a stability demand. And so in that context, I would say sure, because I can load my pinky and my index finger with a bit more, let's say evenness or getting them involved versus doing like an open-handed three-finger drag on a flat edge.
Right.
And so I think like using those tools absolutely will train the FDP muscle. The thing I like about the Rolling Thunder is when you get on top of it, if this was like the top of the Rolling Thunder and I'm here, I'm actually pushing down with my DIP joint and then sagging my body into it. So I'm actually activating the FDP muscle, but in order for it to not slip out of my hand, I also have to flex the wrist a little bit to stabilize it. So I would say, yes, that checks the box of the FDP muscle and the open-handed position. And then with half crimp positions, I think regardless of the tool people are using and on the level edge, a flat edge, whatever, I have my athletes, instead of going straight here, I have them bring a little bit more MCP joint flexion into the hang to add a little bit more extensor side muscle activity. So I think that kind of checks off that box in a lot of ways too, if people are, being intentional with that grip.
Yeah, and you've made some great posts that I'll link to, but essentially what Tyler was showing there for the listener is like if you're training a half crimp, whether you're like hanging or whether you're lifting it up off the ground, you're essentially squeezing into it. He's got some videos there where you squeeze a lime and you're essentially like activating all of those muscles first before then doing the lift. Where you just showed me kind of how you were engaging on a rolling thunder, you were holding it above your head as if you were hanging on it. I've mostly seen people load a rolling thunder on like a lifting pin and then pick up like a 45-pound plate or whatever kind of resistance they needed. Does it matter? Do you hang on it or do you?
I don't think it matters. I'm kind of spoiled. Like I have because now I have just like a room and the bouldering projects close, so I don't have all my like gym grade lifting stuff at my office anymore. So I have like the 6 squat rack in my garage. So when I say loading overhead, I'm loading with a cable stack. So instead of lifting something off the ground, I just click, it's really easy to adjust the weight. So regardless of how you do it, but the thing that I like about the overhead position, it's easier to get your center of mass underneath it to load below it. So I can do more load like that than I can if I'm lifting off the ground. Because lifting off the ground, I have to like lean forward and the weight has to be in front of me a little bit. Or my arm's maybe not long enough to like reach right below me. So it's just a little bit more, it feels better overhead when I'm loading with a cable stack and then I just lower into it for a few seconds. But I don't know that it really matters all that much.
Can you indulge me with just a general set and rep scheme and maybe rate of perceived exertion for how one might use a rolling thunder or a wrist wrench?
So I've been doing it and so for me, I don't have a sore wrist for my strength training sets. I typically do supersets. So I'll do like what I'll do today is I'll do bench press with like a 20-degree incline, followed by like what's called a lat prayer, which is like essentially it's a lat pull down, but your arms are straight. So instead of doing a pull up, you're going like bringing the cable stack towards you. So it's a very lat focused movement. And then I will do a superset of the Rolling Thunder, and I will do like one set of 10, and then I'll do a couple sets of 6, a couple sets of 3. And that's it. But I'll just like do that whole cycle, right? So I just fit it in with that. And then I'll change and then I'll do another superset with a landmine press, a wide grip pull up, and then I'll do a half crimp with an unlevel edge in the same vertical down way, similar set rep scheme.
When you're doing those reps with the Rolling Thunder, are you engaging your biceps to then pull it down because you've got it hooked to a cable machine? So are you pulling it down as if one would do like a lat pull down, or is this more like, oh, I'm just going to
do like a fingerboard? I do like a one arm hang.
Got it.
So I like the idea of actually making because the forces are like, I think I can max that out at like 130 pounds with just my finger, with like being more fingertip focused, but lowering into it feels good because I have very stiff shoulders, just like my body's very stiff, the ligament. So it feels good to stretch my shoulder overhead when I lower into it.
Yeah. Yeah, cool. I've been wanting to play around with this kind of thing. I just haven't gotten around to it yet, and so maybe I
The rolling thunder is cool. I think it's a really, and when I use it, I don't try and like, put my thumb on the finger side and like make it wrist flexion, which is more of a wrist flexor. So a lot of people that use the wrist wrench, they'll put their thumb on the same side of the fingers and they'll slightly curl the wrist here to make it more wrist flexion focused.
right.
Where with the rolling thunder, the way that I'm using it, I'm trying to make it like a curl with my FDP. It's more of a finger exercise the way I'm using it than it is like a wrist exercise, if that makes sense.
Yeah. Would you also then do something that's more risk focused, or does that also tick the wrist box when you're doing that?
I mean, that's where it's like really dependent. Like I'm someone that doesn't really get wrist injuries. My shoulders don't get sore. My elbows don't get sore. Like my joints are tight. They don't have great range of motion, but I'm not someone that's susceptible to getting joint pain. Whereas if you're someone that has had lots of joint pains in your past, those people probably need it as like a supplement that's kind of programmed in, where I never run into those kinds of injuries with the exception of my hip, which is more pathologic, like long term. But, like it really depends on the person where I think but I'm also doing like benching and pulling too. Those are still strengthening exercises for the wrist. So if someone's not doing the basic things, they're not doing weighted pull-ups, they're not deadlifting, they're not benching, like those things to start are more easy to include than a bunch of novel like rotation and ulnar deviation, all the other stuff. So basic strength training works good, but if you're doing that, then adding some extra stuff maybe makes sense.
Yeah. Okay, cool. And then what about on just an endurance side? Because what you kind of laid out there was a more of a strength protocol, 10, then 6, then 3. Is there a benefit to doing a rolling thunder or a wrist wrench hold for 30 seconds at a smaller weight?
I would say that's really a good protocol for people that have pain.
Okay.
So for people that have soreness in the wrist, I do a lot of like that type of load, wrench and flexion, wrench and extension for that, maybe 4 to 6 out of 10 RPE for continuous 20 to 30 seconds. And that's more for like symptom management, but that's where it becomes important, where the diagnosis. So one of the things that is associated commonly with TFCC injuries is there's an extensor tendon on the back of the forearm that actually attaches to the TFCC. And so the presentation looks very similar to a TFCC injury. So if that was the diagnosis and the tendon has like some tendinosis, doing like long, slow isometrics like that would feel amazing. And the person would be like, wow, my wrist feels really good. If that was a lunate, like a bone marrow edema, which is like a bone bruise, that would also be ulnar side of wrist pain. It probably wouldn't be affected by the long duration isometric. Mm-hmm. So that's where the diagnosis, there's a whole bunch of different things that could be wrong there. Loading just like an injection, let's say, is diagnostic and hopefully it's therapeutic, which means if I load someone and they don't feel a benefit from it, maybe it's not the tendon that's injured or that needs the mechanical stimulus. If I load it and it feels great, then cool, that helps my diagnosis, but that gives them a therapeutic benefit, right? So if people want to try things and they want to try to load the wrist, and they're modifying the volume and they're doing all the things and it's not really changing it, that might not be the right diagnosis for the wrist.
Yeah, got it. That makes a lot of sense. Okay, cool. Well, let's talk about other things that could happen to the wrist here or could present pain. You mentioned the top of the wrist. So like if I was wearing a watch where the face of the watch would go, that's another area that would present as some sort of pain or injury?
Yeah, that's the dorsal side of the wrist, so the back side of the wrist. And so essentially, basic anatomy would be if someone's looking at their palm and then they turn their palm away from their face, what they're doing is the primary bone that actually attaches to the wrist is called the radius. Mm-hmm. And then when I turn my palm away from my face, the radius rolls over the top of the other bone. And so it's only the bone that's by the thumb that actually has a true joint with the carpal bones, of which there's 2 rows of 4. So there's 8 bones. And so if it's on the back side of the wrist, the 2 bones that are most likely under suspicion there is the scaphoid bone and the lunate bone. And a common injury that happens with climbers is like you can get a scapholunate ligament sprain, which just goes transversely across those bones. And those people, that commonly happens with like falling. Like if you fall with your wrist in extension, or if someone falls on a mountain bike, or That's a
Snowboarding.
lot of times
Every time I get on a
snowboarding
snowboard, I fall and I hurt my wrist. It must be
for
that.
sure. Snowboarding, skateboarding, things where you're landing with your wrist in extension, that's a common injury. And so, in terms of like a diagnostic, like I do a lot of diagnostic ultrasound, but a diagnostic ultrasound has a lot of limits for the wrist. But you can see the scapholunate ligament if there's a sprain there. That's one of the things that you can see. But someone with dorsal sided wrist pain could also have joint synovitis, but maybe it's just from doing a lot of wrist extension.
Right.
So that would be a process of like listening to someone's symptoms. Can they do push-ups? Can they full crimp, or do they full crimp all the time? Can they do a mantle? If those things all check the boxes like no, 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 then something on that side in that space is likely the diagnosis.
Got it. Yeah, and that's where I feel quite a bit of restriction, just like when I'm talking about like doing dips and that kind of thing. Is taping the panacea for any sort of wrist things? I climbed with some climber friends who like basically before they go out, they're just like, I just gotta get some tape on my wrist, and I don't know if it's a placebo or if it's actually doing something.
I think it's an emotional like panacea for sure. And I don't think it's a bad thing either. It really comes down to a wrist that has stability physiologically and a wrist that has less stability. So if someone has an unstable DRUJ, which is a radial ulnar joint or a distal, like actual wrist joint instability, then taping the joint and climbing out is not a good idea. But that's not that common either. So that's not the most common wrist injury. And so if someone has like sensitivity in the wrist and maybe a perceived instability, which is obviously not the same thing as a true instability, taping the wrist feels really good. And so tape in that context there's a couple different reasons you might tape. It gives you better proprioceptive feedback. So you kind of know where the wrist is in space. It will limit the range of motion. So you won't be able to do as much ulnar deviation. So that also is like a volume management thing. And if people do it knowing that they need to stop doing it at some point, they kind of have a plan to get rid of it, I think it's totally okay.
Cool. Yeah.
I have a lot of clients, maybe one's there that that works with, one of your sponsors as well that wears them on both wrists. And she climbs at a really high level. She trains really hard, but, and she's had an MRI on the wrist knowing that there's some degenerative tears of the TFCC, but still climbing at, very high level for a female her age that like totally manages it, but she doesn't feel comfortable climbing without it. And so in that case, she's still strength trained, she still board climbs, like all the things. And that's okay. That's not really hurting it. That's not really preventing it. But we know there's the injuries there, but having the confidence to load it, I think is totally okay.
Yeah, absolutely. I mean, that's, I think a lot of people wear like the kinesiology tape and all that, maybe more as part of a ritual or a mental confidence, which we know is incredibly important for climbing, as much as it might be as a physiological benefit. One of the injuries that I had in my wrist that was not climbing related, but maybe a lot of parents out there can relate to it, was on my thumb side. And it was when we had our first kid, and I was holding him. I think the PT that I saw called it like mommy wrist or parent wrist or something like that. And it was essentially like this tendon or ligament that goes from like the top of the thumb into the wrist, and it got really inflamed. I ended up having like a cortisone shot kind of put in there, but it was like there was a clicking. I don't know. It got really bad because I was holding my kid a lot with my hand bent, like if you're holding like a beer or something like that, and it's kind of like your hand is kind of bent where the pinky is pointed down, but the injury was on the top side, the thumb side, and there was like a big tendon or ligament that kind of comes out of the thumb there, goes into the wrist, and it got inflamed and clicked, and then it was just like painful as shit, and I ended up getting the cortisone shot for it, and then getting like prescribed some frying pan type PT exercises where I was like rotating my wrist with like a frying pan. Anyway, do you see that much with climbers, or is it just because I was holding my kid with my left hand way too much while I was trying to like cook breakfast and I just never had my hand in that position before?
It definitely happens. I'm assuming did they use the term de Quervains? Do you remember that term?
Yes, de Quervains. That was it.
Yeah. So the mommy wrist makes sense just from the position, but I see that like in ice climbers because they just like constantly, smacking a hammer into the ice and pulling. So there's a lot of like high speed traction of the tendon there, and there's maybe a little compression. So essentially when you flex the thumb across the palm, you create flexion in the joint and you pull the tendon tight across the joint. If I do that a lot, the tendon also has a little compression against the bone, which maybe changes the mechanics a little bit of it, but you rub that enough there, you're just going to create an inflammatory response. So that happens with ice climbers, tooling. And then I've seen it a few times in people that are doing block lifting when they're going really heavy and they're just doing a lot of block lifting really heavy. The thumb's kind of in a weird position. You don't really know what to do with it. And a lot of times people just stress the thumb across the joint, and that definitely creates a high amount of force and friction up against the bones. That's not reported in like climbing research papers, but as a mechanistic injury, that makes sense that climbers would get it, but not nearly as common as ulnar side or wrist pain.
What about for crack climbers? Because you're saying when you fold the thumb across the palm, sometimes you're going in with your thumb down, and sometimes you're going in with your thumb up. When you're going thumb down, that's where you're like rotating that.
I don't see a ton of. I think crack climbers are at least that are doing like a lot of Indian Creek style climbing. That's kind of it's not really out of vogue, but it's not as popular as other stuff. So I think they kind of get washed out with the volume of people climbing at a gym. But I definitely see a decent amount of like metacarpal or, base of the thumb pain too from a lot of traction on the thumb. So yes, the mechanism would certainly be, in line with what crack climbers do with hand crack climbing. But people that are climbing really hard, they're not climbing hand cracks. They're shoving their fingers into small cracks. So like the people that are like doing a lot of trad climbing, likely they're climbing at a high level. They're not hauling hand cracks all day. They're climbing on their fingers. They get rotational, torsional stress to the PIP joint.
Taking a step back and looking kind of more at the more common, I'm assuming more common climber injuries that come in, which are going to be maybe in the fingers, PIP or DIP. We've talked about synovitis. That's a lot for those of us who are crimping a lot or doing a lot of hangboard training or just a lot of volume there. There's also the one that you've posted about climbing on a lot of jugs and kind of the injury that can come from there. Does any of that then radiate or translate down into the wrist, or do injuries in that hand region tend to be isolated?
Like tenosynovitis of the finger certainly you could radiate down towards the wrist. Lumbrical injuries in the hand certainly could present as wrist pain. And most of the time when someone gets like a lumbrical injury from grabbing onto a pocket, the reason they might get wrist pain is because they get now a bit of an asymmetric load of the flexor tendons, because that lumbrical muscle that controls the wiggle is maybe or disrupted. So the timing is off. So if they load it, it's going to maybe shoot through the wrist a little bit. That I hear quite commonly. And then the other one through the wrist would certainly be like carpal tunnel syndrome, which is definitely a pathology in and through the wrist. I don't see that many cases of people with carpal tunnel. I definitely have in my past, but that's not something that I see on a weekly basis, but certainly is something to account for. But the symptoms there are super obvious. It's like my thumb and my index finger go numb every time I do certain things, which is very different than like a mechanical pain.
That is interesting. I mean, you hear about carpal tunnel for people who play a lot of guitar, or I guess like sit at a computer a lot, but climbing, maybe there's just enough variety of holds and movement where you're not going to get that like repetitive thing. Are any kind of, speaking of repetitive things, and in the fact that I'm spending a lot of time on my kilter board right now, are there any injuries that you see that are more common now from board climbing?
I would say, like from my own clinical experience and personal experience, the kilter board probably is more stressful on the wrist than other boards. Mostly because, on the regular kilter board, and I've never climbed on the home board, the regular kilter board, the holds are really comfortable.
Yeah, bigger.
And because they're really comfortable, they're really far apart. And so because they're really far apart, unless you have a really big ape index, you're cutting your feet a lot. So you're hitting a hold really fast, and you're in that open pack position. So there's a lot of range of motion, and there's a lot of swinging and catching. So there's a lot of quick dynamic control on the ligaments of the wrist through, when the finger tendons are kind of at their reach, we got to stretch the ligaments. There's a lot of stress there. Mm-hmm. So I'd say, and that doesn't mean that board is dangerous or risky. It's like if someone has wrist pain and it's on the ulnar side and it came on insidiously and they climb on the kilter board for 2 hours, 3 days a week, maybe the easiest strategy for them is to just try a different board, maybe drop the volume by 3 to 4 problems and spend some time climbing on a different board, or actually climb on gym sets and see if the risk is mitigated a little bit and the symptoms go down. And that actually works really well for people. But, we're all pretty stubborn and we all do what we like to do for a reason because we're good at it or whatever. We're working on certain things. So it's like getting that across to yourself is hard. When someone essentially pays me to tell them the stuff they already know, it's like, you just listen to yourself and you'll like, do very well.
Right. We kind of need somebody, a friend or a coach to help us listen to ourselves. We don't want to listen to ourselves sometimes. We want to just keep doing the thing.
Well, yeah, it's confusing too. Like there's so much information in the world now. It's confusing what to do, and it would require a a lot of work for someone to kind of narrow down the diagnoses of what's going on with the wrist just based on, reading an article or looking through Instagram. It's like, which is the downside of being someone like myself that actually makes content. It's like, it's so hard to make content that actually helps everyone because it's just not possible, And so it's like, hopefully not contributing to the confusion, but that's definitely a factor.
Well, I mean, everybody can just book a session with you and then they can get very specific advice. But I think the content you put out is actually very thoughtful and covers a wide range of topics. Speaking of content, one of the types of content that I've been seeing a lot of lately is these huge like dynos, because a lot of my friends and others were down in Rocklands recently. And so doing paddle dynos and double clutch and just like huge hucks to jugs or slopers. And we've talked a lot about how wrist injuries, it sounds like, predominantly come from repetitive overuse. But do you see acute wrist injuries aside from falling, which we've talked about, catching your fall if you come off awkwardly and you're, kind of falling on your wrists? Is there a risk factor that we should be aware of where, whether it's in a gym or outside, where we're jumping and trying to like latch onto a hold?
I mean, people will definitely get acute TFCC tears and they definitely will pop and they will definitely click. But again, is like the question that we ask ourselves is that moment where they heard it and felt it the real reason why it was sore, or was it the accumulation of stress over weeks to months before that eventually, actually led to where they actually had the tissue tear? Most of the literature would say the former is the answer. It's like the slow build of accumulated stress. And when people are preparing to go on a trip, they're preparing for that kind of stuff by doing those things. And so, again, your tissues all have a limit to how much stress they can tolerate. As soon as we hit that, then we have something that we got to give 3 months to recover from, right? And that's like a average time frame for ulnar-sided wrist pain to go away. It's not going to go away in a week. It's not going to go away in a day. It's going to take a couple months until you actually feel fully strong and resilient that you could go back to doing whatever you want. And so it's really the patience that we really lack in terms of rehab, is people want to get better yesterday so they can climb tomorrow at their limit, right? And it's like, that tends to lead people down the path of like doing all sorts of new random things, which doesn't work well. So I think to answer the question is like, those things are pretty stressful on the wrist, but most of the people that are doing those big hucks are pretty competent and they're pretty well trained and they're pretty strong. New climbers aren't going to do that kind of stuff. And so is it risky? I don't know that it's that risky, but at some volume, absolutely it's risky, but it's really hard to say what that is for any person.
Well, if we are diagnosed with that, or we do determine that we've got the ulnar-sided injury or flare up, or kind of whatever the different levels of injuries would be, can you talk me through maybe moderate, to severe, or minimal to moderate to severe, in terms of recovery time and treatment plan?
So the ones that maybe are the most severe would be certainly like a big audible click pop at the TFCC. Maybe it's a repeat injury there. Athlete is very intolerant of loading the wrist at all. Definitely intolerant, like grabbing a frying pan off their countertop, grabbing a milk jug, any sort of doorknob rotation, constant clicking, like a feeling of instability. Like those people definitely need to go see a healthcare provider to do some special tests to actually measure the DRUJ, which is the radial ulnar joint, and do some orthopedic testing to see how bad it is. And in that case, like most of those cases still are kind of like, let's try a couple things and see if it calms down. If it doesn't get better, then we can order an MRI and go look at it. The thing that's confusing about the wrist in extreme cases is the MRI is pretty sensitive, but it's not the gold standard. The gold standard literally is to go in there under arthroscopy and look and see exactly what's injured. And so MRIs are helpful, but it's not always like a slam dunk diagnosis. And in those cases, those people might need to splint their wrists and not load their wrists for 3-4 weeks and let things really chill and calm down.
Hmm.
Their timeline to getting back to climbing hard is definitely 3 months or
Okay.
longer.
Yeah.
Those people are going to take some time. They're going to need to maybe immobilize and just totally let that thing scar down and heal without stress. Most of the cases that climbers will be under is going to be in the low to moderate range ulnar sided wrist pain. And like we've already mentioned, those people, maybe 8 weeks, 7 to 9 weeks is a good time frame, for them to get better. And that's going to be a consistent, an initial reduction in the thing that provokes it, still some maintenance of climbing that's tolerated well, some small amount of strength training, drop in volume, etc. And then as they progress, you want to add volume, add more positional stress, add more power over that time period, based on their symptoms. And then the lowest grade ones is like, stop climbing on that board for a couple weeks and your symptoms will probably go away. Stop doing that one project for 2 hours and your symptoms will probably go away, And so it's like, and that's obviously a very generalized range, but I think the extremes are the easiest to talk about, and then everything in the middle is kind of like where it gets maybe a little bit more challenging for someone to manage on their own.
Is there anything to do in the moment if you hear whether it's moderate or severe to help hasten the recovery? Just into ice or heat or medication that one can take?
I mean, yeah, those are all managing symptoms. Those aren't really gonna, fix a tissue, or they're not going to speed up the inflammatory response for healing. The basic things still are the most important. Make sure your dietary intake is adequate and your protein content is high. Make sure you're sleeping well. But certainly doing those, modalities, let's call them, is not a problem if someone has a lot of pain. Stabilizing the wrist with like a wrist widget can be quite helpful in the acute setting, so people feel, stable in the wrist, because you can get a low grade TFCC sprain and it'll be really sore. That's not that bad of an injury, but it'll really be sore, and if someone's never had wrist pain before and they have a trip coming up in a couple weeks, the sensitivity emotionally just like gets cranked up, because it like, oh, now I can't go on this trip, like I just spent all this time training. Like that's when the pain kind of doesn't match the actual injury. So in that case, splinting it and bracing it makes sense. Not immobilizing it completely, but like giving a little support is okay.
You mentioned a wrist widget. I'm assuming this is like some sort of like a wrist brace or something.
Yeah, people will definitely know what the wrist widget is. Essentially, it's like a brace with two straps, and so you can put it on the wrist, essentially right where the end of this sweatshirt is, and you can strap it down tight with Velcro, so it really reduces the range of motion.
Yeah, very cool.
So it's like a reminder, right? It's like, don't put your wrist in ulnar deviation. Don't rotate your wrist that much, just because it doesn't really allow you to do that.
When you said that, though, the image that came to my mind was this thing that I used to have when I played hockey, and I just have seen it come around again, just like in my Instagram for whatever reason. But it's like a thing that you hold. It's supposed to strengthen the wrist. It's a thing you hold, and like there's a ball on the inside, and you spin it super fast, and then it kind of gives like some centrifugal force resistance or whatever. What do you think? What do you think of those things?
I don't really know. I definitely have played with one once back in grad school at like some fair or whatever, like a health fair or something. There's people selling those things. They definitely make you super pumped. And so I think people like that because it makes you super pumped, and people love getting super pumped because it feels like that's really valuable because the perception of effort is high.
Right.
But I would say, like, what we know from strength conditioning literature, that's essentially an unstable tool that you're using, right? It's not stable because you're trying to get it to rotate. And so what we know from like rehabilitation literature, unstable surfaces have a function in creating a lot of muscular activity around a joint on all sides. So in that case, it might be helpful to get a lot of muscles activated, but it's definitely not a good strength training tool, because if we're trying to strengthen the muscle, we want it to be stable so we can target specific muscles, because when the platform or whatever we're using has more stability, the muscle can create more torque. So I would say, like,
right.
I don't think it's totally useless. I don't really know how it's hard to quantify, I think, and understand like how hard it is for you and make it harder. I think it has like a fixed intensity, so you probably have to do a longer time using it, right? It would be like the progression. I don't really know. It sounds more confusing to me than it is helpful, because I just don't know how to quantify it well, But it's not useless, I don't think. I don't think anything's really useless. It's just a matter of does the athlete, can they progress it? Do they like doing it? Do they understand why, et cetera? That matters a lot.
Well, in my experience, the real crux of it is just getting that ball to spin fast enough internally for it to actually start doing its thing. So it's hard enough just to use the tool, to get the tool to work, let alone once the tool is actually working. What's the one you guys are always
You have to rotate it, right? This.
you get it started with your thumbs and then you kind of get like a rotation going, like you have to kind of match the momentum of it and then it'll go faster and faster. I don't know. Maybe I'm just not coordinated enough to get it
Or
going.
maybe the thing I don't love about it is I don't love like this as a motion for the wrist. That's like it's essentially an open back position, but you're doing circumduction, like which creates a lot of like just weird shearing stress on the ligaments of the wrist. I would say
Yeah.
for someone with TFCC injury or ulnar side wrist pain, that would make it sore as hell. If someone
So yeah,
doesn't have wrist pain and they're doing it for whatever, messing like challenging their buddies, it's probably fine.
got it. Yeah, and for the listener who's not seeing this video, essentially the motion that Tyler was just saying is like you're holding, like, just picture yourself holding a ball, like a tennis ball, and then just rotating your wrist around in like a counterclockwise direction. Mine's clicking. Every rotation I do right now, I hear a click.
I'm thinking like a Harry Potter. Doesn't that happen on Harry Potter? Like they catch a ball, like the Quidditch ball or something.
Yes.
Like they have to like hold it still, like kind of like that, right?
That's great. That's such a good nerdy reference, Tyler. I appreciate that. Said very well as a father of kids. So if that's out, what do we think of? What is it that you're always memeing? Is it the TheraBar? Is that the name of it? The thing that you twist, the piece of rubber?
Oh yeah, it's just like a thing that you can add torque to.
Yeah.
That thing's fine depending on how you use it, right? And so the thing that is hard to understand about that is like, again, it's hard to make harder, right? They have levels of intensity, right? But when it comes to like a real, and that for the wrist maybe is more appropriate, but like when it comes to like lateral elbow or inside elbow tendinosis, like, the intensity of climbers' forearms, they're so strong, like you have to get a high intensity load. And that's not that intense when it comes to total recruitment levels. But for like basic warm-up stuff for the crags, probably fine to do wrist extension with and to do wrist flexion with. It's something that's easy to carry around, but hard to progress. So as like a primary rehabilitation tool, I don't particularly would say that's a good option because I can't quantify it easily, right? Where lifting weights, I can quantify a loading pin, I can quantify a cable stack, I can quantify plates, but I can't quantify that as well. And so it's kind of harder for the athlete to feel confident that they're actually pushing more weight. Because if you had the same symptoms, let's say over a couple weeks, and you're doing the same thing at the same weight, you're like, oh, this probably isn't working very good. But if I have the same symptoms and my weight is going up, you're like, well, my symptoms aren't gone, but damn, I'm getting stronger. Like, I think emotionally for an athlete, that's a net positive because they're going to be like, yeah, this is getting better. I can do more load. I can push harder, but my symptoms haven't gone away. That's super classic for any musculoskeletal pain complaint. But I know that, but they need to know that for themselves, that they're still doing something that's productive while their symptoms are going to slowly go away. But if they're not seeing a strength improvement and their symptoms are the same, it's harder to like buy into it being, effective.
Yeah, totally. I love that point that you just made. I think that's critical for just the emotional side of injury recovery is, yes, it still hurts, but I just added 10 more pounds and it hurts the same. And so while it's not getting better, I'm getting stronger. And I guess that's the importance of having a PT to say it's also not getting worse, because I guess there's also a scenario where you could be getting stronger, but also like continuing to do damage to the system.
Yeah. And it's hard to do damage. It really is hard to hurt yourself more. Like I probably talk to 30, 40 rock climbers a week. And very rarely do I talk to someone that's like, it's way worse after doing some loading, right? Because ultimately the thing that's going to be the hardest to pin down is the volume, because you can do a long session in a day and something won't hurt, but the next day or the 2 days after, it'll be really pissed off. But it's very rarely that in the moment, someone's going to do something, haphazard for the wrist or for a finger injury that's going to actually hurt it worse, because the brain is like so protective and they're already on guard. They're like, oh, I don't know about this. Let's try. Oh, that felt okay. Let's try it again. But they're not going to be, no one's dumb enough really to hurt themselves worse after they've been injured, especially someone that's actually seeing a healthcare provider that kind of talks them through that, they'll be like, okay, cool, I can try these things, but I need to be kind of cautious. Like they'll amplify that quite a bit.
Yeah, that is interesting actually. So then for self-coached climbers, is it more common that we wouldn't be doing enough? We wouldn't be loading enough in a recovery situation than if we were working with somebody like you would be there to essentially give us the permission to kind of push ourselves a little bit more than we might normally?
Pushing it more in terms of intensity, yes. Pushing them more in terms of volume, no. Climbers will do that just fine on their own. Like,
Right.
because the knee-jerk reaction that you'll have is like, ooh, I did this overhead side pull on the moon board and I cranked on it really hard. My wrist is really sore. They're like, ooh, well, that's cool. I still want to go climbing with my buddies 3 days a week. Now I'm going to go do top rope and I'm going to climb 15 routes on top rope. That's not a very good strategy because all that volume will still stress the wrist, and it's something new maybe that they're not used to in terms of volume, and that's not better at all. But those athletes will also be kind of scared to like do a heavy weighted pull up or do a heavy bent over row. But giving them the okay that that's probably safe, obviously with ruling out some testing stuff, is something that's hard to know for yourself because injuries feel scary to load. But like I would say probably 85, 90% of the people that I talk to with injuries, very rarely is it scary to load, but it feels scary to load, right? And so that's like the thing where you got to start with something that feels very safe, that's very familiar to them, that kind of looks like the sport in some way, and then start there and then just like let their symptoms kind of guide how quickly you go.
Yeah, it's just brings up kind of a more general question. It could be a finger injury or it could be wrist or any number of other injuries. Have there been side-by-side comparisons on recovery time on loading versus full rest? And does loading speed up recovery, or is recovery essentially the same, but if you load, then once you are recovered, you haven't lost as much, or you're essentially just in better shape than if you hadn't loaded?
Yeah, that last point is probably the most appropriate. So if you, let's say you have an injury and you take, and this, talk to a lot of people that do this, take a month off. Like I took a month off and nothing happened. My pain totally went away. But then I came back to climbing and my pain was right back. Mm-hmm. And so what happens is all the healthy tissue also reduces its load tolerance. Not like dangerously low, but your body, there's something called the repeat bout effect. Like if you do a new exercise, go do like 4 sets of 10 with a Nordic hamstring curl. Like you're not going to be able to walk in a couple days. Like that's a new stress, right? If you did that twice a week for 2 or 3 weeks, you'd get used to it. Then you'd be able to tolerate that kind of volume. But because you're not used to it, the repercussions are going to be quite high in terms of soreness. And so when someone has an injury and they back off completely and they don't load, they take their normal tolerance for stuff and it goes down. And that could be like grabbing onto a jug with a little deviation. That could be loading their fingers. So regardless of the injury, it's not that it changes the time frame to get back to hard climbing because they have to build that capacity back a little bit. But if I really get away from the most stressful things in terms of the positions, if we're talking about wrist injuries, and I still keep their tolerance high, that month of modification and reduced volume, when we can bring that back, it should be the same as it was before. So the time that it takes to get back to normal stuff absolutely is faster with some form of loading protocol. And in almost all, climbing injury cases, that can be done. Like there's very rare ones where you shouldn't load this particular thing for a period of time. And that's usually like youth stress fractures in the finger, maybe like dislocations of the finger, bad cases of synovitis if they get steroid injections, multiple pulley ruptures. There's some dramatic example in the shoulder too, but that's not the majority of people that I talk to. Yeah. Those people are flying to Germany to see Volker.
Well, that's really good to know. I quite like that because also then mentally, it's just nicer to be doing things than to not be doing things and know that, okay, well, the tissue recovery time might be the same regardless, but once I'm recovered, I'm going to be back to trying hard on the project or in the gym much faster than if I just took like a full stop break. What about blood flow restriction? And does that come into play on early kind of recovery protocols after an injury?
I mean, it certainly can be done. I don't use it a lot for wrist injuries, primarily because the BFR needs to have like a range of motion to like build pump in the muscle. And
Mm.
so if I have someone with ulnar-sided wrist pain, I'm going to have to do a lot of repetitions of this and a lot of this. And like, I think it just has a lot of volume, and I can find that I can load people with heavier isometric positions that are very safe, that, they'll feel stronger and better faster with the heavier loading than they will with the light loading where they get super pumped. But that's kind of like a depends on the person thing. If it was a stress fracture, sure. If it was like a scaphoid stress fracture, yeah, that makes sense. If it was someone that has bone marrow edema in the lunate or the scaphoid, sure, that makes sense, because I can't put a lot of compression on their hand either in a push-up or a pulling position because the bone is like bruised. So I could use a really light load for those athletes. But for someone with ulnar carpal recess synovitis, no, just use like regular strength training stuff.
Got it. Yeah, because you don't want the higher volume, and that's what BFR is a higher volume under less of a load. But for strength training, you're saying less reps, less volume, and you can do more that way. Well, in terms of just where I'm at right now, which is fortunately I'm not contending with any wrist injuries, and hopefully the majority of people listening right now are also not currently facing a wrist injury, I want to ask you how any of what we've just talked about might help me to get better climbing on slopers, because that is my kryptonite as a rock climber right now. I just don't face them all that often. And I imagine the best thing would be to just get out and climb on slopers, because it's a lot. If I was talking to Jesse Firestone right now, he would say it's your strength isn't the issue. It's just how you're holding your body and its positions and technique and all of that. But assuming I will try to work more sloper climbing into my routine, is there something to add in that would just make them feel more comfortable when I do have to grab them every once in a while?
Yeah, I think you could do like a mix of some strength training. So use a wrist wrench and flexion, works great, or a rolling thunder and flexion, just to like get the flexor muscles recruitment high. But then you also have to practice actually hanging below slopers. And if that's not feasible because you're climbing in the red and you have the home kilter board at your house, you could screw on some big slopers on your wall. That is reasonable if there's space, depending on your setup. Or you could even use, I think tension makes maybe the simple board with like those rounded balls on the side.
Yeah.
Like that would be good, or the Beastmaker board. But the tricky thing about the Beastmaker board is to hang on those. Most of the time, you just drag it down for your fingers. But in order to really make it a sloper, you want your whole palm to be on that thing. And you could just do repeaters like that and give yourself a little exposure to grabbing onto slopers, because a lot of the sloper, obviously the force production is the position of your body and where you are, how you're hanging on it, where your center of mass is. And so just like with the fingers, I would say strength training is necessary for the reasons that it's necessary, but it has limits in the sense of the coordination is not the same as it would be on the wall when you're actually putting your body underneath your hand. So the same thing applies for slopers.
Yeah, I appreciate that. I just need to rock climb more in general. What else? Is there anything else? I feel like we've covered quite a bit here, and I'm grateful for it, because this is like an area that I've just never peeled back on. And as always, in talking with you, there's just so much more to it than my assumption was coming in. But is there anything that we haven't touched on with regard to wrist or wrist injury before we wrap it?
I think that's a pretty good discussion on the most common wrist injuries and some of the rehab ideas. Maybe one thing I was going to mention that we got sidetracked talking about something else is, for you, maybe like training supination might be helpful. And people that crimp a lot, and I'll make some posts on this, people that crimp a lot probably would see an improvement in control by training supination. Because if you think about grabbing a crimp, because the pinky's small, you grab a crimp, but you pull your hand up. But what we do to control it is you torque your wrist, you supinate your wrist, but it's under tension. And so using like a loading pin and a cable machine or an elastic band where you're hooking it here and you're just like rotating it open like that would be pretty useful. See how I use the middle finger? That was pretty subtle. Not on purpose. I was like, I might as well keep it right here. But then like rotating would probably be an easy supplement for a lot of people that would help like their crimp strength too.
And yeah, I saw you post a video. I think you used a loading pin and hooked it to like a cable, and you were essentially kind of rotating your wrist. This is, again, to the listener, I'm holding my fist as if I was holding onto the handlebar of a bike or whatever, and then I'm turning my thumb up to be pointing up. And so it's kind of this rotation of the fist, if you will. That's similar to what I was prescribed when I had that thumb injury.
With a frying pan, right?
Yeah, with a frying pan. So could I also just do it with, I guess there's maybe not enough weight on a frying pan. I would have to then add some weight to the frying pan in order to make
Yeah,
that
the frying pan's fine, right? But then like, what do you do when you're really good at the frying pan? That's the same thing with like an elastic band or those flex bars. Like you could buy 7 of them so you have the whole range, but it's like once you can do the thing and you get some stress with it, doing more volume of it is a volume problem. That's not a strength training progression, where it's very easy to use and there's some other tools that people can buy that arm wrestlers use that literally is like a half circle with a bar through it where they can actually rotate through it. But I mean, being very practical and easy. I shot all those videos for a wrist rehab course that I have online if people want to like, it's mostly for healthcare providers or maybe coaches that like go through all these diagnoses and special test stuff and some testing. But like something that people have very available is a loading pin at their gym. And so if I just grab the loading pin and I have something attached to it, all I need to do is create, different rotational torques in different directions. And that's a pretty good motion for people to train, I think, because we don't do a lot of supination, but you could also do like easy bar curls, train the bicep muscle too. That would help with supination. So that's probably more valuable as a trained range than would pronation be, because we do a lot of pronation when we're climbing already. That might be helpful.
Yeah, it's really interesting to hear, because visually you entered into this talking about how that would help control a crimp, because as you hit a small crimp, you're essentially trying to rotate it towards that ulnar side kind of rotation. You're essentially trying to rotate towards the pinky. And is that because the pinky's shorter and you're just trying to get more force through all of your fingers
you're trying to stabilize the wrist joint? Where conversely, if someone had ulnar sided wrist pain, which are all these different diagnoses, that would probably be provocative. And so if someone's like has ulnar sided wrist pain, the things that you maybe the ends of the spectrum you want to eliminate for the most part, like full crimping might be really sore on the wrist. Big slopers might be sore on the wrist, where use a half crimp, use a 3-finger drag sparingly, but not only 3-finger drag, like get all the fingers on to keep the wrist neutral as like maybe a tie in there. So saying that the training supination would be good for full crimping makes sense for maybe just the average climber for training. But for someone that has like ulnar sided wrist pain, don't start there, because that's likely provocative because of that rotation. Make sure I make that clear.
Yeah, cool. Yeah, this was for me where I'm healthy right now on my wrists and just looking for any extra edge I can get, whether it's crimping or on slopers. Both of them are my Achilles heel. I don't know what my strength is. I guess it's drag, the open hand and the 3-finger drag, because I'm at the...
Well, the thing that's hard about that is like you feel like you need to work on sloper stuff, which is great. Do it. The hard thing is going to be actually doing it, right? Which is like the annoying part of training. It's like, oh, I know I want to work on this thing, but because you're not exposed to that thing all the time with your climbing, it's like really hard to fit it in. So it has to be like some habit change where I think just fit it into your strength training. So every time you do strength training, you do a little bit of it. And that's probably enough for most people. Where if people don't take that approach and they're like, I'm going to get really strong on slopers, so for 2 weeks, you're going to do it 3 days a week at night for like 30 minutes. You're not going to keep up that habit, but it's going to be a big volume of stuff that might piss your wrist off. And so it's like the changes that we make to our training, they need to be a little bit more sensible and like kind of worked into the routine a little bit, at a slower pace than just like getting psyched about something. Getting psyched about something has a lot of risk to it.
That's such a good note to go out on, Tyler.
I mean, I know I do it myself. I still do it myself. It's so hard not to.
It's so true. Getting psyched is the biggest risk factor for us climbers. So I appreciate all that you brought to this. I'm psyched on this chat. And for those listening, if you are experiencing any number of these pain points or restrictions with your wrist, then you can hit up Tyler. Do you still have the online courses available on your website, or is it all now just direct consult with you or Colin?
No, people can do consults with me, which is what I do all day. And then there's tons of online courses. I have one on wrist pain, finger pain, elbow pain, shoulder pain. The finger, elbow, and wrist ones are very up to date. They go through climbing research papers and talk about most common injuries. But then people that have particular injuries and consult stuff is mostly what I do, where I'm giving a lot of the coaching stuff to Jesse and Colin.
Awesome, man. Really appreciate it. I've talked to many climbers, professional climbers who have been on this show, who have and continue to work with you, as well as just like my friend Chris, who I was working with today, where you wrote him a couple plans, and the dude was like crushing it today. And he's been stronger than ever. And I don't know, I guess he's got to be in his mid 50s now. So anyway, appreciate the work that you're doing for all of us climbers. And we'll, I'm sure, connect in the next few months on another topic here. But this is really enlightening, Tyler. Thanks again, man.
Yeah, thanks for the chat.
Well, all right. That wraps things up with our friend and frequent contributor, Dr. Tyler Nelson. I hope you got as much out of this one as I did. I've already started adding just a little bit, not too much, as Tyler said, just a little bit of that wrist flexion training into kind of the last part of my warm-up before I get into my strength training. And it's been going great. I haven't been feeling like crazy fatigued or anything, and I know I'm hitting those muscles in the way that I should. So that's cool, and I hope you're getting after it in your training and your climbing. By the way, as I mentioned at the top of this, you can get a free pro clinic with Dr. Tyler Nelson on the top 10 finger training questions by just popping over to thestruggleclimbingshow.com/strong. That will give you a little field to enter your email. You enter your email, and boom, instantly, you will get that pro clinic episode, which is one of our top-rated pro clinics ever. It's a real banger. And it's just for joining the email list. And on the emails, by the way, I'm just going to send out things like giveaways and little updates on my training and climbing and all that stuff. You can quit anytime, but it's not spammy. I'm just trying to build a bit of a community over here. So that's a no-cost way. In fact, a get value way for supporting me. So thanks for doing that. Another way you can support me would be by coming aboard as a Patreon member, which I would really appreciate. That's really the main way I'm able to make this show week in and week out here in my freezing cold podcast/utility closet. So you can do that by swinging over to patreon.com/The Struggle Climbing Show. There's more than 150 hours of bonus episodes and pro clinics and other resources over there. I think it will make you a better climber and probably bring some joy to your life. And if it doesn't, you can quit. So no risk there. You get a free 7-day trial. And if you don't like it, you can just quit. Anyway, I appreciate you checking that out. That's very helpful for me. And what else? Well, as I'm recording this right now, I am gearing up for a little mini, just like a quick strike climb trip. I'm supposed to go to Chattanooga. We got this huge winter storm. And so I'm actually going out to Vegas, meeting my boy Johan out there. And we're going to do a little climbing for a few days. Also going to be meeting up with some friends and past guests of the show. So while you're hearing this, let's see. Yeah, this will be out. So by the time you are listening to this, I will be back from my trip. So I'll probably have posted some pictures, but planning to meet up with Ravioli Biceps and James Lucas and Alex Honnold and Sonny Honnold and I'm dropping names like crazy right now. Do you see all those names that I just dropped? Look around. They're just like everywhere. They're just strewn around the floor. It's pretty cool. It's pretty cool having a podcast because then I get to like go and have these little climb trips with climbing heroes of mine. It's crazy. All those people I just named, I'm like, what? I get to climb with these people? So great. Anyway, I'm a lucky duck, and I'm going to go out and chuff around on some things, and maybe I'll actually stand on the top of something. Doesn't really matter. I get to go climbing, so I'm psyched for that. And what else? Was there anything else? I guess that's about it. I appreciate you. Thanks for listening. Thanks for your support. Hope you're getting after it. Have an awesome, awesome day, and I'll see you next week.